I want to get into a section that we like to call myths versus facts. And so I've done this for a number of times on this show and just trying to break down again. We're talking about breaking down barriers and creating access and opportunity. And hopefully, as we're talking about cancer sucks, diagnosing it earlier and certainly treating earlier. So here's my section, myths versus facts regarding breast cancer. So I'm going to ask our panel to comment myth versus fact, maybe give a few reasons behind myth or fact. And then we'll kind of go from there. So here we go.
Buzzer or anything?
No buzzer this time. I'm putting you guys on the spot because that's why I know you guys so well that you guys can nail this and hit a home run out of the park. Here we go. Here's the statement. This one's for Dr. 𝐏𝐿𝐿 first. All right, here we go. Myth versus fact. Most breast cancers run in families.
Myth.
And we kind of just answered that. We kind of answered that question. Can you comment a little bit more again, just to hit the point home on this one?
The number one risk factor for developing breast cancer is being born a woman, and family history is a very small percentage of those breast cancers that we see. So, all women need to get screened, not just women with a family history.
Excellent. All right, next question. Here, this is a good one for Dr. 𝐏𝐿𝐿. All right, here we go. Talking about mammograms, here's a statement. A mammogram can cause breast cancer to spread.
It is absolutely false. It is a myth.
And please expand a little bit more on that.
Yeah, I mean, there's no science behind that statement whatsoever. All it does is detect breast cancer. By getting a mammogram, it's not like you're spreading it to the adjacent cells or even, as ludicrous as this can sound, to the other contralateral breast. That just does not happen, and that's just whoever says that to you, run away from them as fast as you're running away from that person who is
still being filmed. Yeah. All right, here's the next one. All right, this one's for Dr. 𝐏𝐿𝐿. All right, breast cancer is contagious.
Myth.
All right, please explain a little bit more.
So, breast cancer is unique to you. It needs its own blood supply, it needs its own fuel sources, etc. And so it cannot be transplanted or spread by any bodily fluids or contact, human contact, etc. It also cannot be spread by a biopsy. So not only do mammograms not cause cancer to spread, but taking a needle and sampling it does not pull those tumor cells throughout the breast or spread them to the rest of the body. So I get asked that every day. If the needle biopsy has now caused the cancer to spread, and that is a myth. It is a tool for diagnosis.
Thank you very much. Next question, Dr. 𝐏𝐿𝐿. Here we go. Here's a statement. Finding a lump in your breast means you have breast cancer.
That's a myth. Although it may mean you have breast cancer, more often than not it's a benign lesion, depending on your age. Under 40 years old, it's more likely to be a cyst or a benign solid tumor, such as a fibroadenoma. So finding a lump does not mean you have breast cancer.
Right,
but it should be checked out.
Oh, yes. Oh, yeah, absolutely, yes. Thank you very much for clarifying. All right, here's the next one. Here we go, for Dr. 𝐏𝐿𝐿. Bras cause breast cancer.
Myth.
Please explain a little bit more. By the way, these are all myths. If you guys are out there listening to us, this is all myths.
So this is a very old wives' tale that I hear daily basis also. Not specifically bras, but I hear underwire bras are supposed to be caused. And the thought is that if there's something bad in the breast, that this underwire may cause these cells to smolder or be spreading within this area and not allowing it to sort of, breathe the normal way. It is not any truth to that.
All right, thank you. Next one. I love this. I love myths versus facts. Because again, we're talking about giving, as I said at the beginning of the show, I want people to get their knowledge from reliable sources. You type in something in Dr. Google, and it says you're dying. I mean, literally, it's like I cut my finger, and I type in finger cut on Dr. Google, and it says you're dying. So again, we want people to get information from reliable sources. That's another reason why I created this show, to leverage my network to help break down barriers. So here we go. And these are questions that I get asked. These are questions that actually are asked to me on this whole myths versus facts. And then again, I want to ask this to my colleagues, but I hear these questions on a day-to-day basis or these statements. All right, next one for Dr. 𝐏𝐿𝐿. Here we go. There is absolutely nothing one person can do to lower their risk of developing breast cancer. absolutely nothing somebody can do to lower risk.
Well, that's not a true statement either.
Yeah.
Obviously, patients often ask, what did I do when I tell them their diagnosis? What did I do to get this breast cancer? And of course, the answer there is you didn't do anything specifically. But anything that makes common sense for good health is good breast health also.
Thank you for saying that.
And there's no magic bullet. There's no number one cause that if you do this, it's not like smoking and lung cancer. There's no direct, strong correlate like that. But anything that you can do for healthy lifestyle, doing things in moderation, doing things that are good for your body, help lower the risk of breast cancer.
Thank you. Thank you for making that statement. Again, the behaviors that we do on a day-to-day basis have an impact on us. And so having those consistent behaviors, staying active, having a healthy diet, getting seen by your doctor on an annual basis for at least a physical exam, these are good things. And again, don't smoke cigarettes. Drink alcohol in moderation if you choose to do that. But just basic common sense things. So thank you for clarifying that and giving us a good statement. All right, this is going to be the last myth versus fact for Dr. Gressick. Why not? All right, again, this is stuff that I hear, so this is why I'm mentioning this. All right, here we go. Drinking milk or dairy causes breast cancer.
Myth.
All right, please explain a little bit more.
So, specifically when we talk about dairy, there has never been a direct correlation between dairy and breast cancer. There have, however, been many studies looking at soy protein, soy milk, soy, etc., and its correlation with breast cancer. Even those studies have been unfounded in terms of a direct correlation. Though there is some interesting science as to the voodoo of that. It is a myth. Anything in moderation is safe.
All right, thank you very much. And I wanna